This is an enterprise by Medico abroad to highlight the importance of self-study amongst medical students. Medicine is a vast subject, and the more you study it, the more you realize that every bit of knowledge gained is but a drop in a never-ending ocean. This is an effort to assist future physicians, and it should not by any means be treated as a substitute for regular classes. Now, having said that, one does gather a lot of knowledge during the medical course, but it's like leading a horse to water. How much the horse drinks is definitely up to the horse, isn't it? But on a more serious note, once you become doctors, you become trustees of the human body. The well-being of your patient is your responsibility. Therefore, you must equip yourself with all the knowledge that you can gather. There's an old Chinese proverb which says, you hear and you forget, you see and you remember, you do and you learn. There can be no substitute to the student's initiative to learn better and to do more. You can augment your knowledge from a number of books. Today, let's learn something about the bones in the chest and the upper limb. First, coming to the bones in the chest. There are a few bones in the chest which actually make up your axial skeleton, that is, the bones in the midline of the body. Yes? And these bones, the most important of these bones are the clavicle, which is the collarbone, and the sternum, which is in the center. This is the breastbone. Now, if you remember, the human skeleton is divided into two. It is the axial skeleton, that is the bones which are present in the midline of the body, and appendicular skeleton, that is the bones in the limbs. Yes, the bones which are attached to the central or axial skeleton. These bones come under the axial skeleton because they are in the midline of the body. They are the two clavicles which are on either side, or the two collarbones. You have the sternum in the center, which is called the breastbone, and then you have ribs. Anteriorly, posteriorly, you have vertebrae. These make up the axial skeleton. In the axial skeleton, you have two parts. You have the pectoral girdle and you have the pelvic girdle. Pectoral girdle is present in the chest and thorax up to the abdomen. From the abdomen downwards, it is represented by the pelvic girdle. So, these bones actually come under the pectoral girdle. What does girdle mean? A cage. Girdle means a cage. This is the bony cage in the body which is present in the chest up to the abdomen, in which all the other organs like your lungs, heart, major blood vessels, etc. are arranged. So this forms a cage in which the other soft body parts are present. So this is a bony cage. Now this is present for protection, and it also has attachment of a number of muscles which are very powerful. Most of these muscles are called anti-gravity muscles because they hold the upper body upwards. Yes? All other animals in the animal kingdom walk on all fours, right? We have a bipedal posture, that is, we stand erect on biped, 2 feet. We stand on 2 feet, that is called a bipedal posture. Now the strength of the upper body comes from the muscles which are attached to the pectoral girdle. We'll take a look at two bones, the clavicle and the breastbone, and we'll study how the rest of the bones are attached to these two central bones. This picture shows you the clavicle or the collarbone. Now this consists of a medial side which is arched anteriorly and a lateral side which is curved posteriorly. Yes, the medial side is curved anteriorly. This is the sternal end of the bone, which means that this facet articulates with the sternum. This posterior side, there is an arch on the lateral side of the bone. Posteriorly, there is an arch on the lateral side of the bone. This is the shaft of the bone, and this is the acromial end at the lateral side of the bone, which articulates with the acromion process of the scapula. So this is the superior surface of the bone, which means that somebody is looking at the bone from above. When you take a look at the superior surface, you find origin of the pectoralis major here at the anterior medial 2/3 of the clavicle. The origin of the pectoralis major. Lateral 1/3 gives origin to deltoid fibers. Posteriorly, it gives insertion to the trapezius fibers, and just behind or above the anterior border of the clavicle, you have origin of sternocleidomastoid muscle. This is the clavicular head of the sternocleidomastoid muscle. So this clavicle is actually held in place by pectoralis major, deltoid, sternocleidomastoid upwards, and the trapezius, which is behind or posterior to the bone. So this is your superior surface of the clavicle. This shows you the inferior surface of the clavicle. This is the anterior border, posterior border. This is the sternal end and the acromial end of the bone. This is called trapezoid line, conoid tubercle, subclavian groove. In this groove, there is insertion of the subclavius muscle. If you remember the subclavius muscle, it takes origin at the first rib at the costochondral junction, and this is where it inserts in the subclavian groove. This is groove for the subclavius muscle, and this holds the clavicle in place. It steadies the clavicle during any motion of the shoulder joint. Now the speciality of the clavicle is that it is a subcutaneous bone and it ossifies from dermal origin. Usually all bones have an enchondral ossification, which means every bone ossifies from cartilage, but this bone ossifies from skin. This is the breastbone or the sternum. Now the breastbone has three pieces. This is the manubrium, the body of the sternum, and there's another piece at the end called the xiphoid process, which is usually made of cartilage. Now let's look at each piece in turn. This is called the Manubrium Sterni. The Manubrium Sterni. It's a shield-shaped bone. Yes, it's a shield-shaped bone. Now at this groove, the sternal end of the clavicle is present. This is the area where the sternal end of the clavicle articulates with the sternum or the breastbone. This is for the right clavicle, this is for the left clavicle. This is called the angle of Louis. The angle of Louis. It corresponds with the second intercostal space. This is near the second rib. This is called the angle of Louis. This is one basic surface landmark on the body. Now, all the ribs from 1 to 6, first to the 6th rib, are called true ribs because they all articulate with the sternum. Up to the 6th rib, they all articulate with the breastbone or the sternum. So that is the first 6 ribs. Now after the 6th rib, that is 7th, 8th and 9th, 3 ribs after 6, they articulate with the costal cartilage which comes off from the 6th rib. So ribs 7, 8 and 9 are called false ribs. Then you have floating ribs which are 10, 11 and 12. They start posteriorly at the vertebral column, but they do not attach anteriorly to the sternum. So this is about the sternum or the breastbone. This is the anterior view of the humerus and the scapula. This picture shows you 3 bones, the scapula, the clavicle and the humerus. Now if you take a look at the scapula, let's look at the parts of the scapula. This is the glenoid cavity, the lateral end of which articulates with the head of the humerus. Now the glenoid cavity along with the acromial angle forms the socket of the shoulder joint. Now the shoulder joint is a ball and socket joint. Now this socket is formed by this angle, and the head of the humerus is accordingly convex shaped. This is the head of the humerus, and this is the ball and socket joint. Now just behind the glenoid cavity is the neck of the scapula. Above that is the coracoid process, and if you remember, the pectoralis minor muscle is inserted at the coracoid process of the scapula. Superiorly, this will be the acromion. The acromion articulates with the acromial end of the clavicle. It forms the acromioclavicular joint, that is the cut end of the clavicle. Now if you follow the coracoid process, you will find the suprascapular notch, the superior angle of the scapula, the superior border, superior angle of the scapula turning into its medial border, inferior angle and lateral border of the scapula. Now this is the anterior surface of the scapula, and this anterior surface shows you subscapular fossa. This can also be called the costal surface, the costal surface of the scapula. The subscapular fossa, which gives origin to the subscapularis muscle, and if you remember, this muscle is an integral part of the rotator cuff. Now coming towards the humerus, this is the head of the humerus, which is a convex shaped head. Just below the head is the anatomical neck of the humerus. The anatomical neck of the humerus. Inferior to that, you will find the greater tubercle and the lesser tubercle. Now these are raised areas on the bone which give insertion to the muscles of the rotator cuff. Rotator cuff muscles insert at the greater and the lesser tubercle. Next you have the surgical neck of the humerus, which is just under that. Surgical neck of the humerus. You will come to the importance of this anatomical neck and the surgical neck in the radiograph. Next you have the intertubercular sulcus, which is a depressed area between the raised tubercles. Between the greater and the lesser tubercle is your intertubercular sulcus or bicipital groove. Bicipital groove. And if you continue down the shaft of the humerus or the body of the humerus, you will find the deltoid tuberosity, which gives insertion to the deltoid muscle. Coming to the distal end of the humerus, you will find that the distal end of the humerus is enlarged to form condyles, medial condyle and the lateral condyle. Looking first at the lateral condyle, you have the radial fossa, lateral epicondyle, this bit laterally. You will find the lateral epicondyle better in the posterior view. Capitulum. On the medial side, you will find the coronoid fossa, trochlea and the medial epicondyle. This is the distal end of the humerus. This is the clavicle. The clavicle is also called the collar bone. This is the right-sided clavicle. This is the right-sided clavicle. Now the clavicle has two ends. This is the sternal end. This is the acromial end of the clavicle. The sternal end of the clavicle articulates with the sternum. The acromial end articulates with the acromion process of the scapula. Now this clavicle, it ossifies from intramembranous ossification. Usually the other bones have a enchondral ossification, which means that they ossify from bone. But this bone is different in that it is a intramembranous ossification. Now the other main points about the clavicle are that it is a long bone, but it does not have a well developed medullary cavity. So hemopoiesis does not occur in this bone. It has a poorly developed medullary cavity. Then this bone is the first bone to ossify in the body. It is the very first bone in the body to ossify. Then fractures of the clavicle are common at this site. This is the junction between medial 2/3 and lateral 1/3 of the clavicle. The fractures of the clavicle are common here at this joint, the medial 2/3 and the lateral 1/3. Now the site of fracture is here, and displacements are common because the pectoralis major takes origin from the anterior surface of the clavicle and the muscle fibers go laterally, whereas the sternocleidomastoid muscle takes its origin at the superior and anterior surface of the clavicle. They go upwards. So the dislocation occurs because one set of fibers pull the clavicle upwards, that's the sternocleidomastoid, and the other set of fibers pull it downwards and laterally, that is the pectoralis major. So this is the clavicle. The next bone that we're going to study is the scapula. This is the left-sided scapula. The scapula has a glenoid labrum. This is the glenoid cavity with the labrum. This is the acromion process. This is the coracoid process. This is the medial border of the scapula, the lateral border of the scapula. This is the anterior or costal surface here. This is the anterior or costal surface. This is the posterior surface. On the posterior surface, you will find the spine of the scapula. This is the spine of the scapula. The head of the humerus articulates here at the glenoid cavity. The scapula actually has a neck just below the glenoid cavity. This is the neck of the scapula. This part is the neck of the scapula. Fractures of the scapula are common all over. It can occur at the coracoid